My name is Erika Vlieghe. That's a Flemish name. I'm from Belgium and I'm an infectious diseases specialist. I'm a professor of infectious diseases at the University of Antwerp, and I'm heading the Department of General Internal Medicine, Infectious Diseases and Tropical Diseases at the University Hospital in Antwerp. As I'm working at the University of Antwerp and very interested in antimicrobial resistance and antibiotic stewardship, I had the honor and the super big shoes to fill to receive, let's say, the Global-PPS as a part of Herman Goosen's heritage after his retirement. However, I had been involved already in antimicrobial stewardship in many places in the world. I started my scientific career in Cambodia back in 2007, starting blood culture-based surveillance and really exploring antimicrobial resistance, and then we found a whole lot of resistance, and then looking together with the local partners for local solutions. And one of these interventions was indeed to perform PPSs, at that moment still handmade PPSs. So I was very happy when Herman and Anne started the Global-PPS in 2015, so that we could start using these, and now it has grown to a worldwide network, of course. Global-PPS is a web-based tool that you can use that helps you to gather data on the use of antimicrobials on a given day in your hospital, and where you look actually on a given day in all the charts of your admitted patients, and you fill out the type of antibiotics people use and the brands and the dosages, etc. And all that goes into the web-based system and comes back with a feedback form and with a full benchmarking tool. So that helps you to objectivate, to state exactly, to see exactly on your given moment how are we using antibiotics in our hospital, and how are our peers in other comparable hospitals or in my country or in my region doing this. So where are we in terms of use of antimicrobials? And I believe really this is the very first step to have such a kind of snapshot, scan if you want, of the state of use of antimicrobials in your hospital. And that's the very first step, then to start thinking, okay, where are we and where do we want to be? Where should we be? Where are things possibly going wrong? And so that can kickstart a whole set of thinking processes and other analysis, maybe additional research or data, and then the most important, start doing things to improve the use of your antimicrobials in your hospital. What I see as the benefits of using this Global-PPS, it's relatively easy to gather the data and to enter the data, and then immediately you get this report, you get feedback, and you're able to benchmark, so to compare yourself, to see a bit where you are. And then if you take steps and you do interventions, you can repeat that and benchmark yourself against yourself over time and see how things evolve. You can also be flexible and say, I will not do a GPPS for the entire hospital, I will focus only on specific wards. So you can really model this a bit to your own needs, and that is exactly, we need tools that are flexible, that are relatively easy to use, with low threshold for people to use. I think that is what we need to stimulate as many people as possible to start thinking critically about their use of antibiotics and looking, okay, what can I do to improve things? Okay, in terms of impact at the moment, I think Of course, you could say, well, the GPPS is only about measuring, but measuring as such is already a very important first intervention, because it creates not only data, but it creates awareness. You need to, it creates turmoil in your hospital, and you need to speak about these data with your colleagues, with your managers. So it brings a lot of life, and that brings attention to antimicrobial stewardship. And it comes with a lot of additional new questions that need to be tackled, etc. So that's at an individual level. So what we've seen over the years is that not only a lot of hospitals worldwide in all continents have adopted the GPPS as a tool to measure and remeasure, and several hospitals have shown already the actions that then they have taken, the little teams they have formed, the focus they have led, say, on making local guidelines or on improving the use of antimicrobials for surgical prophylaxis. And so that's in several hospitals, for instance, in the Philippines or in Guatemala, or in several hospitals in Tanzania, in Kenya, as we have learned from our collaborators across the world. This has really incited a whole set of actions. And that's, I think, a machine that you won't stop anymore, and that's really fascinating. Well, I think the network year after year becomes stronger. Countries, or let's say hospitals, start doing the GPPS. Often they are networking within their own country and create network countries, which then generates a body of evidence for their own ministries of health and their own policy makers. But internationally, you see also that countries from a similar continent often start to know each other or collaborate. Like, for instance, in the making of the outpatient module, several countries from West Africa have been collaborating there together, which is a fascinating process on its own. And year after year, when we come together, either virtually or really in conferences, we see that people start to crosstalk, and actions in one continent can inspire collaborators in another country. So that's also, you have peers, you have people who are struggling with the same issue, and even though the context may be different, you can learn very much from best practices, or what have we done with the results, or what could be done. And so doing the same thing in the same challenging situation, that is really helping people, and that can be really very inspiring. Also when you're stuck in a low resource setting or a politically challenging situation, etc., etc. So the outpatient module, it's the new kid on the block in our GPPS family. It will run in outpatient settings in hospitals. It has been developed with the help of several colleagues from different West African countries, and I think that's very fascinating that it is really coming from field partners across the world, and with additional input from many people really across the globe, but from different viewpoints. They developed jointly that module, and it has been field tested in several African countries, and now we will launch it in spring 2023. And I'm very excited about it and very curious, because of course we all have to be aware that outpatient antimicrobial use is probably much more outpatient use than inpatient use, also in low and middle income settings, and so we absolutely have to understand what and how, and also their measure to improve. For the outpatient module, it's going to come out spring 2023, and it will enable you to measure the use of antimicrobials in outpatient settings in hospitals.